Mummy thumb is a condition that actually affects your hand, right? Specifically affecting the thumb finger and your wrist area, right? Hey guys, welcome back to my channel. So mummy thumb, we're here to talk about mummy thumb or baby thumb, and this is a condition that affects your hand, right? Specifically affecting the thumb finger and your wrist area, right? You can do research. There's a scientific name. The word is too long, so I won't say, but I'll put it on the screen. So mummy thumb is a condition, like I mentioned, that affects your thumb finger into your wrist area, right? So this is caused by the activities that you have to do, the lifting of the baby and whatever else. You know, most of the things that we do with our hands involves our thumb fingers playing such major roles. So that's what caused this condition, and it takes place in new parents. It can be developed sometime post pregnancy, you're just having the baby, right? So, and it's a condition that usually, based on my checks, it's a condition that can go away as well as it can be treated. All right, so I have had experience with it, so I'm going to talk about my experience with it, right? So I realized when a few weeks after I have baby, you know, lifting the baby and everything, I realized that my wrist started aching a bit, affecting even my thumb finger. But I wasn't thinking, I didn't even know this condition existed, first of all. So I wasn't even thinking this was what it was. As far as I know regarding the hand is carpal tunnel syndrome, but it's not that. So I was like, this is weird. Earlier in my preteen years, I would have sprained my wrist. So I thought that was what was happening, but I was like, it's affecting me a whole lot more than it usually does, and it's been a while since I even feel anything ache with that. So I watched it. It continued until it became very uncomfortable. It still wasn't at its worst stage, but it was very uncomfortable for me. That was sometime in September, right? So I decided that I need to see a doctor, right, that focuses on the bone and all that, so I can know what really is going on. Because at that point, it was affecting me doing simple tasks, washing plates, and of course, I'll try not to hold the baby as much because I have a nursing pillow that I utilize as much as I can, and it's that flexible. So, and I'll have different things that I use. So even when to feed my son, I'll put him in the nursing pillow. I'll put things, you know, in front of him to basically heist the bottle so he can go in his mouth, instead of me holding and having to, you know, holding him and having to hold the bottle for him. So like I mentioned, fast forward to now having the appointment with the doctor, right? And I was telling him, he was probing, asking me question, you know, what exactly is hurting? Is it all the fingers, or is it just the thumb, or whatever? And I was telling him that, you know, not all my fingers were aching. It was just mostly the thumb into the wrist area. So what was happening was that due to what I had to do and what new parents and moms, what I had to do, the lifting, probably the washing out of the clothes, everything, because like I mentioned, your thumb is so essential to everything that you do. It actually can inflame the wrist or cause this problem to, you know, get a little worse or make your wrist or your thumb ache a lot more. So I was explaining that to him, and he was like, it's not carpal tunnel syndrome, because I was like, is it carpal tunnel syndrome though? And he was like, no, because seemingly carpal tunnel syndrome would have affected all the fingers, but it was just the wrist. So he was telling me now, enlightening me about the mummy thumb, which I did not have a clue about before going to that doctor's appointment. And he was, you know, explaining the different stages of how to treat it. Now the first step is to get medication to deal with the inflammation in the wrist, and that was what we did. And he also we discussed getting the splint brace, right, the thumb brace, because I didn't even know that the wrist brace, there are several different ones, so I had to get one specific that support this. Let me show you. This is looking a little bit worn now because I've been wearing it ever since, and I should be wearing it. So this is what it looks like. It's a little worn, so please be guided. This can be purchased on Amazon as well. I purchased mine at a local pharmacy. I'm gonna put it on to show you. I purchased mine at a local pharmacy, so you can check the pharmacies and ask them for the mommy thumb, right? So this is how it looks. So it supports the thumb finger, and in this area there are two metals back and front that actually give support to the thumb finger, and he advised that I should wear it as often as possible. Now when you look at it, it's quite supportive, but how practical is it to do everything in it, especially washing? So you know, you have to use your discretion in doing that. You get it? So when I'm washing or dealing with anything with water, I'll remove it. So that was the first step in treating it, taking the prescription, which is to reduce the inflammation in the wrist, right? And also wear these. I bought two. Wear them as much as possible. This right hand, which is my primary hand to use, was aching a whole lot more than the left one. Now at present, this one aches a little bit more than before, but not more than this one. It was just this morning because I didn't fall asleep. I didn't put them on last night, so this morning this hand was aching in my sleep. So as much as possible, if you are a new mom or expecting mom or having this condition, I hope this video can be educational for you or supportive in some form. And like I mentioned, this is a condition that can resolve itself over time, but I gave one step of what my doctor suggested, right? So number two is that he would have said, if it's a case that the prescription and these didn't work effectively, right, it would mean that steroids can be injected in the wrist. All right, if the steroid didn't work, then worst case scenario, surgery. I don't want to go to step 2 or step 3, so I am sticking with this. I would have finished my prescriptions and I'm working with this. I also try to utilize the ice pack. Disclaimer, I am not assuming the role of a physician in this video. I am merely telling you about my experience with mommy thumb as a new mom, and to see if this can be educational and supportive for somebody who is at an early stage experiencing signs of this, or who is currently going through that. So please ensure you speak with your healthcare professional for the best method that suits you. Now you can also do your research. Some of these methods or steps that I mentioned might be also recommended by your doctor, but please do not consult your doctor. Go to your physician and consult with them before you take your step in treating it. But this primarily, I think you can get this as well. And like I mentioned, it can be purchased on Amazon. So, right. So, all right. So I would have experienced it. Like I said to you, I still experience it at times because, of course, the baby is growing and it's quite unrealistic for me not to lift him. So it actually affects it. And one of the things that, based on research too and what was discussed with my doctor, is that resting the hand helps a great deal. Pretty much an hands-on person, so I'll do everything for myself and for the care of my child as well. So sometimes it's not as practical to rest the hand. All right, so I hope this video shed a bit of a light, and it was actually educational for persons who are approaching this issue, going through this issue. Speak with your healthcare professional. It's just one more challenge that we as women have to deal with, but that is it. It could have been worse. Now, if you like videos like these, keep on watching.